Welcome back and a special welcome to folks on onespotmedia.com. Up first, come clean. That demand from spokesman on health Dr. Maurice Guy from the government about the true extent of the country's oxygen supply. He made the call citing conflicting accounts of the management of the COVID crisis in public health facilities. Krista Campbell has our story.
Is there or isn't there enough oxygen for COVID patients in public health facilities? For the third consecutive day, a member of the opposition is demanding the truth from the government.
We are also advised that whatever supplies are in the country now will last only until Saturday, Sunday. Now, the minister and the government need to tell the people of this country what is the real situation.
Opposition spokesman on health, Dr. Maurice Guy, is also not convinced there is adequate preparation for additional supplies of oxygen should the need arise.
It does make sense to talk about having measures in the hospital to save oxygen here and to save oxygen there. We need to ensure that where the bulk oxygen exists, that the tanks are properly filled and they are filled on a timely basis. We need to ensure that the cylinders that are there, that are filled and filled on a timely basis, on a rotational basis, so that the hospitals will have oxygen, so that the lives can be preserved and the lives maintained.
Now, Health Minister Dr. Christopher Tufton has maintained that there is enough oxygen supply at public health facilities, despite controversy about the ministry's timely communication with the sole supplier of medical oxygen, IGL. Meanwhile, another supply of medical oxygen was shipped to the island on Thursday. Still, Dr. Guy says it's been difficult to trust the government's word about what's happening in the public health sector. He noted that too many hospital workers are dying from the coronavirus, while the government insists they have adequate personal protective gear and other safety protocols in place.
We are hearing a different story from the end users. The nurses are saying that, in fact, the same CEO of the Cornwall Regional Hospital lamented some time ago that there was inadequate provision of PPEs. But the minister says that there is adequate supply. So what is creating the problem? Is it a logistical problem? If it is so, the minister needs to solve it.
He says if it's true that the government has not used any of the $9 million surplus from the previous quarter, that money would go a far way in helping to address the COVID crisis.
Spend some of that money to pay the outstanding amounts owed to the doctors and the nurses who get their hazard allowances. Spend money to employ more doctors, as they have been forced to do, but what we felt was the right thing for them to have done from a long time. And put more money in the infrastructure, pay your bills for the health suppliers so that there will not be any tardiness on their part to provide the services.
Krista Campbell, TVJ News.
Meanwhile, Managing Director of IGL, Peter Graham, says public hospitals should have adequate supplies of medical oxygen going into next week. He says a large shipment is to arrive tomorrow evening, noting the shipment is from Jamaica's primary source in the region. Last weekend, all public hospitals reported dangerously low levels of oxygen, with some running out. Meanwhile, the Ministry of Health says it is investigating whether the oxygen shortage resulted in any COVID deaths, as has been reported.